Hello and welcome to KMTV, your roundup of what's going on in Kent on Friday, June the 12th. An investigation following the deaths of a mother and her young son has recommended the speed limit on the Sheppey Crossing is cut to 50 miles an hour. Jem Collins has more details.
Yes, it was at the preliminary hearing of an inquest into the death of 42-year-old Deborah Roberts and her 8-year-old son Marshall, who died after a collision here on the Sheppey Crossing July last year. Kent Police have recommended that the speed limit be lowered from 70 miles an hour to 50, and while the coroner said she wasn't at liberty to make any recommendations, she was concerned about things like visibility, speed limits and stopping distances, and that there could be more deaths. This is Jem Collins in Sheerness for KMTV.
It's been revealed nearly £8 million has been cut from mental health services in Kent over the past 4 years. It comes as a new report from the Care Quality Commission shows more than 40% of people suffering mental illness are receiving inadequate care and the system's struggling to cope. The CQC also say A&E staff demonstrated a lack of compassion towards patients with psychiatric issues. Figures given to the KM Group have revealed a big increase in the number of people in Kent reporting to police they're being stalked. Jem Collins is back with this special report.
When Kerry Barnett was a victim of stalking 8 years ago, it was something that was to stay with her forever, even inspiring her to set up her own app to help those in dangerous situations.
Started off someone being just really friendly and you know, over weeks escalated into something that became very concerning, and then to a point where I had to involve the police. You know, just taking a trip to the supermarket was scary. You're just being followed and being watched, and it's not exactly a pleasant thing to go through.
Since Kerry's case, however, there has been some significant changes in the law surrounding stalking, as new legislation has been brought in to make it easier for victims to get justice. And now crime statistics show that more and more people are coming forward to Kent Police over the past 3 years. Figures show officers recorded 9 cases in the last month of 2012 after the new legislation came in. 47 were reported in 2013 and that rose to 88 last year. But police here say this rise is actually an indication that the new legislation is working.
Whenever new legislation comes in, we have to train our officers to start considering these new offences. The trouble with stalking behaviour and harassment is it can manifest itself in other offences like criminal damage or public order offences, and very often you can prove the specific offence but you can't necessarily prove why a person is doing it. But more and more as we understand it, we start to look for the stalking behaviour behind it, and when we can prove that, we will use those offences.
However, for Kerry, while she's pleased to see more people finding the courage to come forward, she still feels that more needs to be done. This is Jem Collins for KMTV.
In other news, a dad of 7 who died in a crash on the A20 in Kent has been described as a hard-working man who would help anyone. 44-year-old Andy Roberts was killed in a collision on the Swanley Interchange Slip Road in the early hours of last Saturday. A 33-year-old man from Northfleet arrested in connection with the huge crash in Southborough has been bailed until next month. And police investigating a large fire in the centre of Maidstone have arrested a 21-year-old man from the town on suspicion of arson. And finally, Kent's newest hospital has opened its doors to patients in Dover. The Buckland Hospital will offer a wide range of outpatient services, has an X-ray department and minor injury unit. It's cost over £24 million to construct the new centre, which will be fully operational from Monday.
I'm very proud. I had both my children at the old hospital, and I also ran an intensive care unit in the old hospital about 25 years ago. So I've worked clinically in the old hospital, and it was wonderful in its day, but it is now no longer fit for purpose with modern health care. So to see this go up and be able to offer really good health care in a wonderful purpose-built facility is tremendously exciting.
There's more local news on KMFM, and you can also follow us on Twitter and Facebook, but that's it from KMTV.